As usual, another great guest, but a quick diversion. You'll notice that our full name is the Marketplace for Health, Wealth, and Freedom. Well, let's talk about your health for a moment. If you'd like to escape from the stranglehold of insurance and be able to see alternative doctors or go across state lines for care, then you definitely need to take a look at patientempowerment.mpb.health and see if that's the fix you've been looking for. Now, let's get back to the show.
Welcome, folks. Another week, another edition of Freedom Hub's Health, Business, and Politics webinar. We have one of our co-hosts. When he isn't seeing urology patients, he likes to dart out of his patients' rooms and come join us on Wednesdays at noon. Jared Wallen. Really excited to feature Dr. Wallen today because he kind of, fits the panacea in so many ways. He's part of that cohort of healers called specialists, whom we're all waiting to see when they're going to go independent and get more cash patients, and he's doing it. He's also got Boku business background, MBA, assistant manager of retail stores. So as a specialist urologist in the hospitals, he could take his MBA knowledge and really see what was wrong with the institutions. He's diversified in revenue. He's also a realtor. So he can really coach his fellow business people, his fellow doctors, on how to become independent, because so many of them are scared. They're comfortable being employees in hospitals. And even though the third parties interfere with their standards of care, they're just not up to the challenge of being independent. But more of them are, and Dr. Wallen's going to coach his fellow specialists how to do it from his experience at UNW Urology, Director Urology. And he'll correct me on the names and everything. But yeah, also he understands the chicken and the egg problem we have around cash, where it's not enough just to get doctors of all types to offer the appointments for cash patients, but also to coach up patients themselves to shop on cash. I know at our Forbes featured sharing company with health savings accounts and other accounts, we have a beefed up concierge department to hold the hand of the patient to do that shopping. But so I'm excited to hear Jared present. Jim, do you have anything, my co-host freezing there in Bethesda, to say?
No, I don't. No. Great to have you, Jared. Looking forward to this.
All right, Jared, it's all yours.
Perfect. Let me share my screen. It's saying that I can't. Can you make it so I can share my screen? Now I got it. All right. So I got about 60 slides, a little bit more, a little bit less, but I'm just going to try to run through this. I try to go with high energy, like a little bit a la Tony Robbins and what have you. I won't make you guys dance today, but I do want to talk about, let me get to the front of this, sorry. We do want to talk about, basically the medical economy that currently exists and how direct care can shape the future of that in a competitive market, right? So UNW Direct Care Urology is my practice that consulting practice that I'm opening and in the process, and hopefully what should be done by the end of Q1 here this year. In Sarasota, Florida. Self-directed medical care is a niche that I saw in the marketplace that didn't necessarily exist. There wasn't education for patients, digital education online, ready to go for patients to learn how to take care of the direct care market. And so to be able to deliver that value, business is all about delivering value to folks. And so that's where we created this program to walk patients through the best avenues for them to save a lot of money and also get the best quality care they possibly can throughout the marketplace. Whether that's through Cash App, whether that's through Mishi or whatever resources we can give you, many other things to help you, kind of take advantage of the system rather than having the system take advantage of you. So this is me. I'm a surgeon. I'm a patient. I'm a fierce patient advocate. I got into this business, worked my butt off in my 20s and 30s to be able to take care of patients. And unfortunately, the control to do that is slim to none in this marketplace currently. In the current system is corporatized and very, static because of that to some extent. So my business background, I do want to highlight this a little bit because I want you to understand who I am and what knowledge I have to bring to you. So I did a MBA, executive MBA at London School of Economics and Political Science. I've also got my realtor license, like Charles mentioned, in Florida, and have done some business training with real estate investment as well, which is, I think, very business oriented, and done some, a commercial real estate certificate at MIT and some other stuff. Plus, I'm also on the digital marketing steering committee for the USF Muma College of Business's digital marketing certificate program. And also I work with the social media committee for the SMSNA, the Sexual Medicine Society of North America. So plus I mentioned earlier, I do, take a lot of my business training from Tony Robbins, from Russell Brunson, Dean Graziosi, a lot of marketing and business folks, business coaches that are out there. I'm actively, being shaped by them as well. So let me tell you more significantly, what does it matter? What do I believe in? I believe in empowering patients and doctors to rise together to compete in a direct value payment exchange. The reason I believe in that is because I think that's the cheapest, best medical care you're going to find in the marketplace. I truly believe that in my bones. And so, whether you agree with that or not, that's certainly something we can talk about, but that's what I believe. And I truly believe that if the patients and the healers stand together, the game is over for big business healthcare, period. I mean, look at it, before pre-1980s, when it was very low cost still, almost 3,000% less for medical care expenditures every year. And now, we're seeing, significant craziness with 10-to-1 administrators, which we'll talk about. But again, if the patients and healers stand together, the game is over. So I also believe that people in corporations show you who they are. And so by that, I mean, take someone's actions, take someone's, what they do to you or how they manipulate you, see the writing on the wall, so to speak, right? And so that's where I think a decent amount of people struggle, especially if you don't have that great of a business background, because it's really a chess match, right? I mean, they can give you certain options. And if you don't want to play ball, a lot of times, as I think a lot of the clinicians on here know, if you don't play ball with corporate hospitals, then they get rid of you, or they, try to write you up or that type of stuff, which is silly. Again, we'll talk about why the administrators shouldn't be in charge of medicine a little bit later in the talk here. But so I'd like to ask a few questions, whether you want to put this in the chat, whether you want to, unmute and say yes or whatever, or no, whatever your answer is out front, that's fine. But so show of hands, given the current status of the medical system, how many people in the room feel like we're being taken advantage of? Do you feel like you're being taken advantage of, whether you're a patient, whether you're a healer, whether you're some entrepreneur trying to help out the system? How many people feel like you're taken advantage of? It looks like a lot of people, everybody that I can see anyway. So number two, how many feel like we're at least partially responsible for where we are? Whether not that necessarily that you made the problem yourself, but we have some responsibility in the matter, right? We have to have skin in the game, as everybody talks about in business and in real estate. Skin in the game is very important, and patients don't really have much skin in the game, I think, as a lot of people know right now in the traditional insurance system. And that's part of where we lose control as well, right? So patients lose control about their choices and that type of thing when they don't have skin in the game and they don't have, those resources outside of insurance, trying to do everything. So this is what we're going to talk about. We're going to talk about the predatory healthcare system. We're going to talk about how we got here. We're going to talk about the mindset and psychology shift. I think that's the most important part to take away from today. And then we're going to talk about how we can collectively take back the power. And this is both for patients to some extent, but also for healers, right? So clinicians, what have you. I hate that provider word. It's nasty. Don't ever use it. It's a healer or it's a clinician or a physician, whatever you want to call me. Otherwise, other than that, it's all good. But anyways, that's just a little soapbox for us healers out there. Anyways, so the healthcare system, this was a quote from Steve Forbes. He was the keynote speaker at the Free Market Medical Association meeting, annual meeting last 2020. And if you know Keith Smith, he's the Surgery Center of Oklahoma guy, Atlas Billing, they had a great meeting and hosted Steve Forbes as the keynote. And he said that specifically the healthcare system breeds passivity and dependency. And that's 100% true. We think that the easy button is the insurance card. We can just present it and, get whatever care. Obviously, I think all of us in the marketplace know that either care gets denied for whatever reason, all these things stand in the way of you actually getting, sorry, that's the wrong slide, but anyways, that's okay. Stand in the way of you actually getting the care that you want with the insurance card. It's not quite as easy as it should be. And I mentioned earlier off video or off recording that one of the things in business is the simplest way to solve something is probably the best solution, right? Or at least it's kind of theory, right? If you can simplify things like it was pre-1980s, before we had 10-to-1 administrators and all these regulations that the government enforced on us, which we'll talk about a little bit later. Again, people are a little bit brainwashed, and that's what this next slide is the United Healthcare Syndrome, right? So this is something that I created as a little spin-off of the Stockholm Syndrome, whereby if you're a captive, bank robber, whatever, say you're a captive, you essentially kind of start to develop, some people can develop a psychological bond with their abusive, whether it's the burglars or whatever, abusive relationships, what have you. And so they empathize and sympathize and kind of love or what have you, develop this relationship. So I feel like United Healthcare Syndrome is at play in our marketplace today. A lot of people think that, they're going to present their card and they're going to get everything taken care of. I think that we know a lot, that there's, a lot of different ways that they basically disrupt that process and either deny care or have such narrow networks that you can't see who you want to see. You can't see Memorial Sloan Kettering or MD Anderson or these places that are the top-notch places in the world. And so, unfortunately, even as early as the 2008 primaries, Hillary Clinton said insurance companies make money by spending a lot of money and employing a lot of people to try to avoid insuring you. And then if you are insured, to try to avoid paying for the healthcare you receive. This is 2008, folks. I mean, this has been going on for a long time, right? I know you guys all know this. And from a patient perspective, this is what it looks like. We've seen about an 8% increase in income, wages versus inflation, although some of that may be erased now that we've had 7.5% inflation this last year. Beyond that, though, in that same time period, I think this is over a 10-year period. In that same time period, basically, we've had 55% increase in family premiums and 111% increase in health insurance deductibles over those same 10 years. So we're continuously, as patients and healers, being put in a negative position. We'll talk about that a little bit more later. I'm just trying to figure out, there we go. Hopefully you guys can see the slides well. So in healthcare, I think this statement holds very true. Where there's complexity and lack of transparency, there's deception and big profits. That's where the markup discount game that Marty McCary describes comes in play, and we'll talk about that in a little bit more in a second here. So, ultimately, the hospital insurance industries are a large part of the problem. There are now 5 healthcare hospital systems, 7 insurance companies, and 11 pharmaceutical companies in the Fortune 500 list as of 2020. And that's obviously 2021 was a huge calendar year for a lot of those folks. 2022 looks like it will also be pretty, heavily weighted in their favor based on vaccines. Although I think maybe you saw recently Aetna actually came in with their earnings below, so that there's a lot of people that sold off Aetna and the stock crashed a little bit. But ultimately, these guys are doing pretty well for themselves. And specifically, when we look at, this is a source from Yahoo and investing.com, when we look at the top 5 insurers, they've grown from anywhere from 535% to 1,409% in their stocks in the last 10 years, from January 2010 to December 2021. So 1,409% growth in United Healthcare stock. And think about it, they're also gobbling up all these physicians, all these practices, all these facilities, what have you. And so, that's somewhat of a dangerous thing. We talk about transparency in medicine as far as payment wise. And, ultimately there's a little bit of conflicting data, which we'll talk about in the next 2 slides. This one shows a study of 500 hospitals by patientsrightadvocate.org. Only 5.6% of hospitals were compliant with Biden and Trump's price transparency for hospitals to be able to list their prices online and that type of thing. Now, there was also a competing study in June of that year that showed only 39% were non-compliant. I personally, this was based on data from Millman. This is based on data from patientrightsadvocate.org. I think if I had to, I would lean a little bit closer to the 5.6 because I believe their data better personally. Rather than industry data. We might see some parallels to normal daily life right now with that as well. But anyways, regardless, whether it's probably somewhere between 5.6 being compliant and 39% being non-compliant. So somewhere in between there. Anyways, no penalties have specifically been forced. Our government hasn't even, it's been a year in and our government hasn't even forced penalties yet, which could be up to $2 million a year for a hospital, but even that is somewhat chump change compared to the revenue and profits that they're making. A lot of these hospitals, not all of them, but a lot of them. And so we talked about the markup discount game a little bit earlier. I briefly mentioned it. This is a theory that Marty McCary kind of describes, I think, pretty well in his book, The Price We Pay. Basically notoriously inflated hospital prices. It depends on which insurance, what price you get. A lot of times they won't even give you the price if you try to call and ask about although I think it's becoming more common now, but even so, it becomes difficult. And each insurance company negotiates with a different discount, right? And so the size of the margin is huge. We'll look at it a little bit different in a second here. And gouging, you're basically gouging the sick and injured. And, again, Marty McCary says anywhere between 2 and 23x what Medicare would pay, which we'll talk about is obviously a shrinking sum pretty much every year. So, but even so, when you're marking it up 23x, that's a significant amount of money that you can make off of patients or what have you. And so this is the markup discount game. Remember, just like any other retailer, the hospital's insurers, have set prices for each insurance. And, the insurance companies have the 80-20 rule, right? So they have incentive to spend more money. And so they inflate the prices up. And then there's a big portion of the discount game that comes into play to allow for a big gap in what's paid versus what, where the profits go. So this is a specific example of joint replacement. This is Medicare rate of $13,000. 1 in 6 US hospitals charge more than 90K. And actually Lutheran Hospital in Brooklyn charged 115K. This is again, data, I think, from Marty McCary, 55% increase from the prior year. So Medicare rate is $1,300 and these hospitals are charging 115. I'll give you an example from my career. I just had a patient that only had Medicare Part A. And so he was actually not covered for outpatient surgeries. If we were going to do that, I was looking at doing a procedure for him to help him urinate better for his prostate, and pretty common routine procedure we do. But because he was Medicare Part A, he would have had to pay the hospital $20,000 for that service. I can tell you at an ASC, I can get the exact same thing done for less than 10 grand out the door, no problem. So that's also a specific instance. 69% of Americans have less than $1,000 in their bank account. Medical bills are now the #1 cause of bankruptcy in the United States. That's crazy. It's crazy. And this is from the Kaiser Family Foundation, looks at uninsured non-elderly folks as of 2019. Of those that were uninsured and non-elderly, 73% said coverage was not affordable for insurance. And so, and that's 2019. Think about now how that's changed. It'd be interesting to see how the numbers have changed. Take that a step further, nonprofit, it's kind of actually an oxymoron. I don't know if anybody's actually specifically described it that way, but it's actually tax exempt hospitals that are unfortunately, kind of causing problems. They're basically not delivering that much charity care, which they're supposed to do to attain their tax exempt status. And they're able to, write off all this uncompensated care that Dr. Keith Smith purports and talks about. Ultimately, again, this is a nonprofit that's tax exempt, making lots of money, making millions, and owns a collection agency and relentlessly sues the poor. This is from 2019, and I think in Memphis, hospital in Memphis, right? So they had done 83,000 lawsuits in 5 years. And actually, I think in Virginia, in 2017 alone, they actually had 20,000 lawsuits filed in the state of Virginia alone. And I think there was only 37% of the hospitals that were in the state that actually sued patients, but the ones that did filed 20,000 lawsuits that year. So again, we're inflating prices. We're basically suing people over those inflated prices if they're not paying. And again, you're paying way more than you otherwise would in a direct care market, in a cash basis. I don't know. I don't personally love the cash. I love either direct pay or direct care model, whatever you want to call it personally, because I think that cash is fearful to people. So I think that a direct care or a direct pay relationship is much softer and doesn't kind of raise the hairs on the back of your neck, so to speak, as a patient. So I think that's important. Obviously we have to participate in this marketplace, this value exchange together. And so there's some of that psychology that will, an easy change can kind of change people's mindset as far as how they view it for patients, if it's more, pleasing to their senses. So So again, how do we get here? Well, I mean, there's data from, this is from the Harvard Business Review that shows that physician-run hospitals have quality scores that are 25% higher. Unfortunately, this is actually a quote that I love. It's not specifically regarded towards medicine, as Josh Kaufman, who wrote the Personal MBA, was talking about business in general, but I think this applies directly to medicine. The administration aren't supposed to make the hard decisions. They don't know enough. The important decisions are made by individuals who have the most direct knowledge and experience about the areas in question. And that's in medicine, that's either going to be the patient, the nurse, the doctor, physician, what have you. And those are the main people that should be making decisions, not insurance companies and corporations. So how do we get here? Well, I mean, again, I mentioned a 10-to-1 ratio of administrators to physicians. This graph I think was actually made by our colleagues, the Citizen Health folks, John Chamberlain and Brennan Hodge, but they go through in detail all these different legislation pieces here that have been passed. And we see the inflated costs of medicine in the yellow line. You see the stagnant growth of physicians, this bottom teal line, which really hasn't grown much at all over this basically 40-year process. And so look, basically physicians are stagnant, the costs are inflated, and the red mountain is the 10-to-1 inflation of administrators to physicians, right? So there's 4,500% almost, or 4,200% growth in administrators in 40 years. And you see the parallels in the inflated portion of the cost. Now, no disrespect to the administrators out there in healthcare. I know there's some good ones, but I would tell you from my experience, having some management experience, having all the medical experience and working in a corporate hospital, I know more business and more, ways to go about changing the system and making efficient, good quality care than they do. And unfortunately, that was a big place that I butted heads with a lot of the administrators I've worked with in the past, just because I have a very high standard of care for my patients. I try to treat everybody exactly like I want my family treated. And so if there's things that I can do to make their experience better or what have you, remember, business at its key is an experience. You're giving someone an experience, whether or not you're trying or not is up to you, but you're giving someone experience when they come and do business with you. So I think from that standpoint, you see all these legislation pieces that the government has kind of had their hand in making more and more administrators. And obviously that's a huge problem. So Affordable Care Act was also one of these things that, outlawed physician ownership of hospitals, CON laws, certificate of need, if you all have heard about that. That's been problematic. And then we're up against Goliath, right? I mean, in 2020 alone, hospitals, insurance companies, and pharma lobbied with $650 million. If you look at when you add in the Chamber of Commerce, which the reason I added in is because the Chamber of Commerce and the Texas Chamber of Commerce were basically suing, I think, to block the price transparency bill. So they kind of showed their cards there, right, as far as whose side they were going to be on, whether it was the hospitals, insurance, and pharma, or the people. And I don't think it's the people. So that's almost $1 billion in 1 year. And that's just what's on the books, right? So, again, between the ACA crushing, private practices with, non-ownership of hospitals, and also we'll look at here in this slide, a specific graph of looking at physician reimbursement versus hospital pay and practice costs. So the first important part to know is from 2001 to 2020, practice costs have gone up 32%. Our reimbursement in the same time frame has dropped almost 24% for Medicare, which, remember, Medicare is kind of the gauge of how commercial insurances pay us. And to some extent, obviously elderly people, there's a lot more of them. So there's a lot of Medicare patients. But I would argue with you that if you take solely Medicare, you probably won't be able to continue to run a practice as a physician currently in this market because of increasing costs and decreasing reimbursement. And I mean, it was actually set to potentially decrease up to 10% this past year, but ultimately they did some lobbying on our side and got that reduced. But even so, over the same time frame, as practice costs have gone up 32% and physician reimbursement has dropped 22%, hospital pays has gone up 60%, right? So that's a huge problem as far as the marketplace, as far as competition and being able to compete, thinking about from a physician side, being able to compete in the marketplace and stay open and obviously you have to be able to run a practice to be able to help patients. It's no different than taking care of your health and being healthy and doing activity and drinking lots of water and this other stuff to stay healthy, to be able to serve others. from whatever business you're doing. So again, due to COVID-19, 8% of US doctors closed their doors. And that was up to about 16,000 fewer practices nationwide. That's a lot. And you think about it a step further, from a hospital standpoint, they talk about their staffing issues. There's some data that just came out. I forget what the exact source is, but they were talking about a 30,000 bed decrease in the nation right now, as far as capacity, because they don't have staff. And that's, bad management, in my opinion, quite honestly. I mean, if they treated their staff well, their staff wouldn't be having high turnovers in the hospitals as they are right now and having all these travelers. Yes, there's the money portion of it, but obviously there's a lot of other factors that are in play. So yeah, I mean, there's 30,000 less beds. There's I think 5,000 less ICU beds in the country right now because of staffing issues. So how well are these administrators running things for the actual patients that are out there, right? Physicians are only paid 7.3% of our total national healthcare expenditure, which is now just under 20% of our GDP. It's 4.1 trillion this past year. It's crazy. I mean, between the nurses, the physicians, physician assistants, NPs, what have you, they're basically making 30% of the slice, and the rest of it is going to big corporations and health insurance companies and hospitals. And then, obviously being laundered, or I guess lobbied would be a better term, into the pockets of politicians to keep the laws in their favor. So
Jared, go back one slide.
Sure.
Who's getting the bulk of that pie? I can't see it on the screen.
The bulk of that pie is not healthcare providers. The big red Pac-Man is non-healthcare providers.
So institutions and payers
Correct.
and pharma.
So, obviously with decreasing reimbursements and increasing costs, the physicians, healers are on a hamster wheel to see more and more patients and decrease the time they spend with you to be able to keep the lights on, right? So that's a problem that we need to solve. And obviously, looking at this slide again, we're up here at the top already. So how do we, and look where we were back in 1980, when it was simple, before all this legislation and all these administrators, when it was a direct care relationship. The simplest solution is probably the best. When you work directly with your healer, that's what it was pre-1980s. And then we've had a lot of these changes. We're up at the top of the mountain now. And look at this significant growth in costs, and how do we get back down the mountain, right? We're probably not at the peak yet, but hopefully we can make some major changes to start coming back down in altitude of this mountain and costs. And I'll show you why that's important for patients here in just a little bit. So from that standpoint, obviously, again, there's this huge mountain that we need to reverse. And I just highlight at the bottom here, the teal highlight there. Remember, look at how small of a slice of that physicians are, all 1 million plus physicians. That's how small of a slice we are of the costs. And so if you really want to make change, when you look at this big red arrow to the right of the screen, if you really want to make change, you can make much more change by getting rid of a lot of these administrators and getting the corporate medical practice out of the equation and getting back to patients and healers. So this is going to create a need for a huge mindset shift. So that's what we're going to talk about for the rest. This is a quote from Tony Robbins: "The most painstaking crafted plans are useless if we can't manage to act on them. Success is achieved throughout a plan that is 80% psychological and 20% strategic." 80% psychological. First and foremost, your mind must be set to take advantage of this. Tony Robbins also is very famous for saying, change your story, change your life. And I'm going to give you a free bonus at the end here, if we have time, if Charles doesn't cut me off, to help you change your story and start to change your life. So what it's going to take from both patients and healers, in my opinion: uncomfortable action, persistence, empowerment, and responsibility. Those are not things that we typically do, uncomfortable action, just out on a whim, but that's what it's going to take. It's going to take it from both patients and healers. So why does it matter to patients? Number one, is all their money. And so from that standpoint, I have a slide here. Yeah, right here. So this is all employee money. There's 156 million people that get health insurance from their employer right now, and it's being pissed into the wind, excuse my French, and basically going to these big insurers, right? And this slide is from the Kaiser Family Foundation, again, showing the premium increase over essentially a 20-year period from 99 to 2020, right? And so this to the right is the light blue is the worker contribution of your fees. So the average family of four is spending about $5,500 out of pocket after they get their paycheck for their insurance. But look, their employer is paying another $15,700, right? So 21, actually, I think for 2022 or maybe it's 21, the number was up above $22,000. Remember, most families have another probably between 5 and 8K in deductibles. So that's basically $25,000, $30,000 that you're spending out of pocket every year for care that you may not even get. Remember, 60% of people don't even meet their deductible, right? And so again, if you want it cheaper and the simplest solution, work directly with your healers to basically beat the game, right? And so again, why does it matter? We're all patients, whether I'm a physician or a son or a lot of different hats, what have you, we're all patients. We all need care sooner or later. And the final part is it really matters to patients because the establishment isn't going to change for our benefit. I think we know why. There's a lot of money. There's a lot of benefits for them to keep it the way it is. And in fact, actually, Warren Buffett was quoted at the recent Berkshire Hathaway annual meeting after Haven failed, the startup project with Buffett and JP Morgan and Amazon, right? That failed after a year. But he said specifically, most people on the boards of health systems are the most prominent members of communities, and they are pretty pleased with the way things that are going, because that's the way that they arranged it to their favor, right? And so again, we talked about the lobbying before. It's a David versus Goliath situation, right? So how can we take back the power? Well, I said again, like Spider-Man says, with great power comes great responsibility. I think the reality is that's how that lies in both the hands of the healers and the patients to work together and make the simplest solution. Keith Smith, again, from the Free Market Medical Association, Surgery Center of Oklahoma, he said specifically, and he said it multiple times, how can we take an oath, the Hippocratic oath he's talking about, to treat a patient, do no harm, and allow their lives to be financially ruined? And that's what's on my heart all the time as I'm thinking about how to transform medical care. So again, it goes back to simplicity. If the patients and the healers stand together, the game is over. The David versus Goliath comes with the knights against Goliath to help David and take over. So again, these are simple. I already mentioned this is an individual health plan comparison with easy solutions that can drop somebody's annual expenditure as an individual from $11,800 to $6,400, or sorry, to $5,300, saving $6,400. That's just one simple thing. Similar for families, $29,000 versus $11,000 based on the average out there. So you're saving $17,000 as a family. Because obviously for patients, it's very important to conquer the fear to basically get around the excuse of, well, I don't have the money. Well, I'm showing you exactly how you can have the money versus what you're doing right now. Obviously, the legislation back in World War II where they could deflate, wage freezes, but we could inflate the costs we're spending on somebody's health benefit plan significantly plays into the fact that, also the fact that businesses use that money as a write-off. So they don't really have any control to control costs. And remember, businesses are actually supposed to be a fiduciary as far as your health insurance plan. But a lot of them, I think, if you really truly evaluate their plans, they're questionably acting in the fiduciary in the best interest of their employees. So again, 156 million people that have employer-sponsored plans, and they're spending a lot of money. If you can get a high deductible with an HSA, I know Charles loves the HSA. From that standpoint, the reality is there's a lot better ways to do this. Again, that same joint replacement, $13,000. We're looking now at the Surgery Center of Oklahoma's price, direct care surgical, and it's under $16,000. Now that does, I think, not include the cost of the implant, which I think is another $3,000 to $5,000. But even that, you're looking at about $20,000 for a knee replacement. We're just looking at this where there's places that are charging $115,000 out the door, or not out the door, but basically in Brooklyn. And that's not just a temporal or a physical location difference. That's a heck of a lot more. There's 1 in 6 U.S. hospitals that are charging $90,000. So why can we do it for $20,000, but we're charging $90,000? Again, that's where there's a huge slice of the pie that's going somewhere else. We also need to give patients resources for low-cost, high-quality services like labs, images, medications, and transport. Those are 4 of the main things that patients get screwed on as far as extra charges and inflated costs, whether it's a $10,000 CT scan or any number of different things that I've heard out there. It's crazy. Again, make it simple. If the patient and the healer stand together, the game is over. This is actually a free challenge that we're having soon. So stay in touch with me. You can always email us at jared@selfdirectedmedical.com. But this is a free 5-day challenge that we're having for basically patients, entrepreneurs, anybody that, so this works best for entrepreneurs and self-employed folks and independent contractors because they have the freedom of choice, right? A lot of them employee sponsored plans, but there are pearls in this training program for pretty much everybody, even Medicare folks. Some of those are Charles' solution with MPB Health. Some of those are like an HMA, what have you, that Charles and I both sell. But regardless, this is a free challenge, 5 days that we're going to do probably about an hour to an hour and a half of your time in the middle of March, where we're going to basically, again, the Health Insurance Crusaders Challenge. It's time to make major changes, and let's do this. So I was hoping I could over deliver today. Charles, we still got a little bit of time left that I can eat up. About 5 more minutes.
Sure.
Perfect. So bonus for you today. This is something that I learned from Tony Robbins. Remember, we talked about the psychology, the mindset, what have you. The power of incantation can be very valuable in changing your mindset, right? Your mind is probably one of the things that you can control the most. Again, Tony said, if you want to make major changes, 80% is psychology, and the mind is obviously significantly tied with and intimate with psychology, right? So the power of incantation, which is basically, speaking the results you want over your life, can be a very great way to kind of retrain your psyche and what have you. And so I just want to teach you a simple one that Tony teaches. And it will basically be, the difference between incantation and affirmation is affirmation saying, I am happy, but you're not really, your brain says, I'm not really happy. And then you're just like, well, all right, whatever. But incantation is more like, I am courage, right? So pick out one word and say, the same word over and over. I do this sometimes when I'm out for a walk with a dog. I do this something, and the whole goal of it, especially mindset and psychology. And I'm not sure if Mark Aubrey's on here with Impact Physician, but I think he has some great solutions for physicians. But regardless, as far as business training and what have you, and regeneration, like we were talking about before, but regardless, you need the mindset. And so again, you're basically, sometimes I do this in a cold shower. Cold showers have been very regenerative and health benefits, out there. And so I'll just jump in a cold shower and I'll just be like, kind of close my eyes and be like, I am courage. I am courage. I am courage. I am courage. And just kind of, getting into and going through some other stuff that he does too. But I think that looking into that, and I do have a recording that he has that if anybody wants, they can, touch base with me afterwards. And I'm happy to share. But, I think it's smart to really focus on that, both from patients and, a healer standpoint. So, even from that standpoint, something simple could be like, hey, I have the power to control my health and finances by, getting creative with my medical care and taking back control of the choice decision without having to spend more money and what have you. So again, I think it's great. Get active, get the speaking good words and incantations over your life. There's also one more that I'll just teach you really quickly. It's basically, I think like 6 or 7 lines, but it's basically like, now I am the voice. Now I am the voice. I will lead, not follow. I will believe, not doubt. I will create, not destroy. I am a force for good. I am a force for God, if you will, if that's something that's important to you. I am a leader. Defy the odds. Set a new standard. Step up, step up, step up. And I think that all of that is certainly key for both patients and healers to reset the psyche. Again, the mainstream media loves to throw negativity at us. They found that 60% more ads, get more clicks and sell more stuff if they're negative. So obviously they're going to send us all the negative stuff we got, right? We have to, essentially kind of get back into the army chant and really kind of take back control, both patients and healers. Don't get me wrong. I think you can't have one without the other. They both have to be present for the marketplace to exist, right? And so that's where I think the beauty of the free market is, and direct care, direct pay, what have you, as far as changing the future for all of us. So with that, Charles, I'll end it there, and we can go with whatever questions or comments anybody wants to share.
Indeed, Jared, fantastic. And I'm very thankful you added that incantation over the last few years of this weekly webinar. I've had a few fellow Kundalini yoga teachers come on, including Satbir Khalsa from Harvard. And there's no question that mantra, which means in Sanskrit, the mind's projection through vibration, impacts your life. In the Bible, the first phrase is, "In the beginning, there was the Word." So the Tony Robbins of the world understand that. And I think I speak for the audience here that we thank you for telling us about that aspect of success. I am bountiful, I am beautiful, I am blissful. I teach an easy meditation for folks. You stretch your fingers out at the base like a lotus at your heart and go, we are a God in Sanskrit, humi hum, brahm hum. There's all kinds of things in all kinds of disciplines. I'm sure Jim will talk about some martial arts things, people can do. It's also attached to healthcare. Integrated health, self-healing comes from yoga, meditation. So anyways, raise your hand, folks, if you have a question, and I'll just start until folks raise their hand. Oh, I see Linda has a question. Go ahead, Linda. Unmute yourself, Linda.
Linda?
Linda? Your presentation was excellent, Dr. Wallen.
Thank you.
I have to tell you something. The whole system works because Big Pharma and the system wants people to get sick, to be sick, close to death. And within the system, according to your slides, the doctors are the poorest in the system. Okay. When I was making a presentation to my medical students, saying that prevention of the disease is better than trying to cure things like these, then some students said, then we're not going to have a job, we'll lose a job. And my answer was no, because your clients will be the entire population. You don't have to wait to have the sick body, but the entire community population under the supervision of the doctor will be, since this person is happy and healthy and everything. It's a long story. I could write more things about that, but as the system is now, is totally sick. Thank you for your slides. Excellent.
There's no money in health, right? Or at least not as much as there is in sickness, unfortunately.
Absolutely. No. Yeah. Okay. Anyway, I can write some documents and send back.
Yeah, absolutely.
So Dr. Wallen, you mentioned my affinity for the HSA, and you also mentioned the HMA. Do you want to do a quick elevator pitch, how you advise folks on either? I can do it first.
Absolutely.
If you want,
I can do
or
that.
you can.
No, that's fine. I can do it. So I think that they're great. They're both out-of-pocket tools in my opinion. Although again, I think Charles and I both believe that the HSA is best served for retirement. It's triple tax-free. Shock a bunch of money in there, invest it. It grows tax-free. Once you hit retirement 65, then you can use it for anything. It's just based on your income tax, not any further penalties. Under 65 there are some penalties, and you do have to have a high deductible health plan, which Charles also sells with MPB Health. There's a sharing component that you can get access to a MEC and have a high deductible health plan, basically, so you can still have an HSA. Different from the HMA. HMA is basically a prepaid Visa account where you contribute every month, and over the course of 3 years, your money actually doubles, right? So it 2x over the course of 3 years, and it's a card that you can use for all your outpatient transactions. You're basically getting everything at 50% off at that point, because you've already prepaid and you have this extra value delivered based on the actuaries that developed this account, right? And so there's no requirements for health insurance or anything like that you need to have to be able to get an HMA. And the other part I didn't mention about HSA, you can no longer contribute to an HSA when you hit retirement, when you hit 65. But with an HMA, you could start this as a Medicare patient. Remember, I mentioned my patient who was Medicare A and didn't have any outpatient coverage. he could have had, $20,000 in a $10,000 where he basically pays less than $10,000 and has $20,000 for outpatient, whatever he wants on a Visa card that's ready to go. And you can just pay it as you go, right? So that's something that Charles and I offer. If you're interested, certainly chat with us. Obviously, I think that those are both great accounts. Absolutely.
Yeah, I sell all three to people. $200 a month is the sharing cost. It's such a better deal than insurance. It's
Right.
also not adversarial, which
Right.
you mentioned with the Hillary quote.
Right.
They'll fight you on both coverage and billing.
Right.
I tell folks, you may get a fat subsidy on the exchange for Obamacare, but if you get cancer or heart disease, guess what? The centers of excellence are not in the network.
Right. Oh, it's
That
heart
is-
disease too, huh?
Well, I mean, the centers of excellence aren't in the network.
Yeah, that's fair. Well, that's the biggest downfall for me. Again, as a free market person in general, not even just as medicine, but in general, appreciating the free markets as a businessman. The reality is, again, that's where you're going to find the best quality and the best price, right? So, simplicity rules king always.
Yeah, Jim, you're next.
Okay, thank you. Yeah, the point that Linda brought up and you agreed on, sick care, we have a sick care system really versus a health care system. And to have even, whether it's a healer or I wouldn't even use that word. Let's say these medical students sitting there going, well, how are we going to make a living if people are healthy, right? I think there's a big ethical issue here.
Yeah.
And I wonder if that's something you and people like you, all of us really want to address somehow up front to get people to like shift their mindset right in the beginning. Like, who are you to, tell me I need to be sick or you don't want to take really the right care of me.
Right.
So you can make a couple extra bucks.
Right.
We have families, our kids, whatever it is. So
yeah, and I think that's a great point, Jim. I think that, the reality is, again, we have to make it easy for healers too, right? Make it easy for patients, make it easy for healers to break free. You mentioned, I think not so bluntly, but, obviously a lot of that is the inflated cost of education by the government, which inflates the debt that healers are leaving with, whether it's physician assistant, nurse practitioner, what have you, or even physician. I think out of my colleagues, I think most, like 50% or more, are at least $200K in debt when they leave medical school training and college and what have you. I mean, I had $450,000 of debt between a little bit of college, but mostly medical school. I mean, I went to Rush on the west side of Chicago. It was $43,000 just for tuition, plus another $20,000 to live in Chicago. It was great training, don't get me wrong, but I mean, it's a significant amount. I've not even ever had a mortgage in my life, but I've got $450,000 in debt that I got to take care of, right? So I'm lucky because I don't have kids yet, so I don't necessarily have as much to worry about. Certainly trying to solve those problems for healers to be able to break free, because I firmly believe that breaking healers free of the insurance in the hospitals, breaking patients free of the insurance in the hospitals, and meeting in the middle in the ASCs or whatever. I mean, I can do 95% of what I do as an outpatient. So from that standpoint, I don't necessarily need to be, tied to a hospital, an office and an ASC. And that's a simple, easy price, the cheapest I can do myself,
and maybe we teach these, there's a lot of people in this country or wherever
Right.
you are,
Right.
plenty are going to be sick because they're already in that, they're older, whatever the case is. So
Right.
don't look at that. Work on getting them better because you're going to have a flow of people for a long time.
Right. Well, and that's, obviously, again, that's some of the regenerative stuff that's out there and alternative medicine and all these other things that are important. Right. And quite honestly, even just an example, a lot of healers, a lot of physicians that I know don't necessarily believe in hormone replacement, natural hormone replacement with testosterone, estrogen, progesterone, insulin, what have you. We had these hormones when we were younger and healthier, and now they've gone away. Why would we not just replace those hormones rather than throwing synthetic pharma at you and help you live happier and healthier? I mean, testosterone is known to be an 8-fold increase in bone growth. I mean, what old woman doesn't have osteopenia, right? So I mean, it's crazy. And I'm not saying women need a lot of testosterone, but they do need estrogen, and that's important for their bone growth too, right? So I mean, this goes really deep, right? I mean, they've I mean, a lot of people are talking about different types of issues that with COVID vaccines or treatments or whatever, but I mean, this goes far beyond that, and you're talking about a lot of money that big pharma loses if people are happy and healthy and have normal testosterone. I mean, think if every man in the country had a testosterone of 800 or better and felt like he did when he was 25, 30, I mean, that takes away, there's actually some evidence that say that it's actually cardioprotective, right? And so, again, if you're over 40 and you haven't had your hormones checked, personally, I would tell you to do it, because I think that it's important to replace those and keep you happy and healthy. And remember, that's also good for our minds, our brain, right? Everything. I mean, the heart is a big muscle, right? So if you drowned it of testosterone, then I mean, muscles love testosterone.
So Sydney,
the shots hurt.
There's some creams. We know a cash pharmacist, Sean Needham, out in Washington. He's got a 200 milligram per ml cream that you can put on every day. That's easier if you don't like injections.
Last question, Sydney. Good to see you, my friend. Speaking of entrepreneurs creating the cash appointment markets, go ahead. Tell us about Mishi.
So thanks, Jared, for your awesome talk. Very thorough and insightful. Thanks for fighting the good fight. We need more clinicians like you, more clinicians that get it and are kind of able and willing to take a look past the current kind of structure that has been kind of forced upon us. Like you said, we're in a system that incentivizes sick care, and it makes sense because sick care costs more when you're more sickly. The treatment costs more, and we're more dependent on insurance, right? The whole point of insurance is to help us, shield us from the cost of care. And in the past, it was, I think, cost a lot more to kind of shield us from care or shield us from the cost than it does currently. And wellness care is more affordable, frankly, and well care is more affordable. But if we use well care and we're more healthy, we don't need insurance. So it kind of makes sense that we're kind of, they want us to be beholden to the sick care model. You wouldn't go through insurance to get an oil change or to get your brakes repaired. And that's maintenance care that keeps the car healthy, and just like you said, hormone treatment, wellness care keeps us healthy and out of the ER and out of the urgent care center. It just comes down to seeking out that care. Previously, and frankly, in a lot of instances, preventative care and wellness care isn't and wasn't reimbursed by insurance carriers for that specific reason. So yeah, it comes down to shifting the paradigm, and all that stuff makes sense. I mean, just like you said, you're referring to Occam's razor. The simplest solution is usually the best one, and that 100% is the case in healthcare. You take out the middleman, like we have in so many other industries, and you put in some technology. In my opinion, put in some marketplace technology that helps connect consumers, which we've been forced into that position of consumers, by the insurance carriers and by the system. You connect consumers with clinicians, at the transparent direct care rate, cash price, whatever you want to call it. I like to use pay as you go care just because it's more descriptive for consumers, because that's a big responsibility that we have, is to educate consumers about this option. You connect people at that cash price, and that's more affordable than what they would pay towards their deductible. And that's not just a subjective concept. That's an actual objective thing. That was the concept that led me to create Mishi, is the fact that that cash price saves clinicians from the upwards of 30% in billing costs that they have to pay to collect on revenue from the insurance carriers. And let's say use $100 just for the sake of simplicity, and frankly, that $100 is about what you would get for a level 3 office visit from Medicare. $100, you're paying, $20, $30 to collect on that $100. So net reimbursement for a clinician is $70, $80. The consumer is paying that $100 towards their deductible. And so if you were to charge the consumer directly and bypass insurance altogether, you charge that consumer $85 or $90. The consumer saves $10 off what they would have paid towards their deductible, and the clinician yields an extra $10, $15. So it's not, the cash price of care is not taboo. It's a formulaic value driving concept. And so I think you're what you said in terms of educating people and both clinicians and consumers about that concept and bypassing insurance and kind of taking back healthcare, like I like to call it. I think that's the only way forward. And I think doing so in an aggregate way, using networks in the same way that insurance carriers have created these clinician and provider networks to screw us. I think that we should empower ourselves to create clinician networks to screw them and help us take it back from them. You said empowering consumers to take advantage of the system rather than allowing the system to take advantage of them. And I think that's what it's all about. So look forward to connecting with you, Charles. Thanks for the platform for a little bit there. And thanks again, Jared. Awesome talk.
Thank you.
Anytime, Sydney. And over the past few years, we've hosted several entrepreneurs like Sydney with cash appointment platforms for employees and healers, and to help this direct pay relationship, not cash or pay as you go. And we certainly will have all of them back, Sydney included. They're focusing on different markets. I think, Sydney, you're in San Diego, New York, Chicago a little bit. And others are doing Detroit, others are in Kansas. And we have come to the end of today's event, Jared. So why don't you say goodbye and how folks can reach you?
Thanks so much, Charles, for having me and letting me talk. You can reach me at jared@selfdirectedmedical.com, or you can go to selfdirectedmedical.com, or the Health Insurance Crusaders Challenge is our website for the new challenge, or Health Insurance Crusader with no S is the website for the new challenge, but that will be launched here in a few days. Otherwise, you can always continue the conversation on the Freedom Hub website, right?
Indeed.
So what about your wealth? If your money could actually talk to you, would you listen to it? Well, with the DNA Network Academy, your money actually can talk to you, and it's going to tell you just what it told this client. This family had over 24 debts, mortgages, car loans, the works. They were on track to take 20 years to pay it all off, and instead did it in 8.5. Plus, they did it without refinancing, making more money, or even changing their lifestyle. So find out for yourself with a free analysis that is completely confidential. No personal information, no social security numbers, no credit checks, none of that nonsense. But what is exciting is that the outcome of that report you receive is a guaranteed outcome for you. To get that report, head on over to bit.ly/debt2wealth. You will arrive at this simple form. Fill it in as simple as lender number 1 and credit card number 2. What really matters is the accuracy of your numbers. You'll be able to see that if instead of 20 years or whatever your number is, that you may actually be out of debt and on your way to wealth in as little as 6.3 years like this client.